In today's news, the curfew and in-person visits to Her Majesty's prison to be extended by 14 days.
CDC issues a level 4 travel alert for BVI as COVID-19 crisis continues to engulf the BVI.
And Dominica's recent increase in positive COVID-19 cases has been linked to travelers originating from the BVI.
The Ministry of Health joins forces with Eureka Medical Clinic to promote and improve local PCR testing capacity.
And Antigua's Prime Minister blames BVI's Chief Environmental Health Officer for COVID crisis. Later says comments were a pushback following Michael's public criticism. All this and much more after a word from our sponsors.
The wait is over. CCT Fire is here. Experience ultra-fast downloads, seamless streaming, and even more reliable connectivity on an all-new fire-blazing super-fast CCT Fiber network. CCT Fire. Bring it home and upgrade today.
Welcome everyone. It's Tuesday, July 20th, 2021. I'm Kamal Haynes.
And I'm Ron Grant. We're coming to you live from Tortola in the British Virgin Islands. From Tortola to Jos Van Dyke, Virgin Gorda, and Antigua, we've got you covered. A happy Tuesday is wished to each and every one of you. Thank you so much for tuning in. Before we get into our newscast today, just touching on some summary items. It's not right. COI should have paused hearings amid COVID upsurge, says Premier Foy. The House of Assembly clerk reportedly told not to dictate how legislators uses their funds. And outrage, Craft Alive vendors without electricity for some months, they say. And Premier denies impropriety in badge contract and stimulus grants. In addition to that, the USVI governor advises on vaccinating frontline staff and full lockdown here in the BVI. We're of course going to get into that later on. Kamal, take it away.
Well noted, first we start with news of the curfew. The government has moved to extend the territory's curfew for an additional 14 days, effective from Friday, July 23rd. Well, Minister for Health Carvin Malone made a disclosure while delivering a statement during a recent COVID-19 update. Well, he said the decision was made following recommendations handed to Cabinet from the Health Emergency Operations Center. Take a listen.
The government of the Virgin Islands, guided by the advice of the Health Emergency Operations Center, the Unified Command Team, have been vigorous and deliberate in their attempt to ready this territory and our territory and our people for more than a year for such a time as this. While the turbulence around us seems to be relentless and without end, we must remain diligent in our purpose to make every effort to support and assist each other throughout this crisis. As we continue to navigate what we call the uncharted waters, Cabinet following a report from the HEOC Unified Command Team, decided to renew the curfew order for a further 14 days from 7 p.m. to 5 a.m. effective July 23rd, 2021, meaning that the current curfew will run up until July 23rd and then be renewed for a further 14 days.
Malone further encouraged persons to limit their outdoor activities during the curfew period, stating that persons should remain indoors unless required to conduct essential business during the day period.
In support of this extended curfew, Cabinet decided that members of the public should stay at home and work remotely where possible, and persons should avoid loitering at all costs. It is expected that between the non-curfew hours of 5:01 a.m. and 6:59 p.m., members of the public should stay at home unless for purposes of work or conducting business, obtaining services or supplies, including for the purpose of the COVID-19 testing or vaccination or any approved outdoor exercises.
Minister Malone also revealed that Cabinet decided to extend the restrictions placed on in-person visits to Her Majesty's prison for a further period of 14 days from today, July 20th. But this decision is with the exception of emergency situations, which Minister Malone says will be determined by the prison to necessitate such a visit.
Now, the Ministry of Health and Social Development has joined forces with Eureka Medical Clinic to improve PCR testing capacity locally. This was confirmed by the Ministry of Health in a media release issued recently, which said the ministry was working with the management of Eureka to bring their PCR testing capacity online in a safe and effective manner. Acting Chief Medical Officer Dr. Ronald Georges said the ministry has held an initial discussion with Eureka Medical Clinic to have additional PCR testing capability available in the territory. He said, and I quote, "We have reached out to Pan American Health Organization to provide the necessary support to ensure that the necessary biosafety and quality aspects are independently verified and are in place prior to the start of testing." Dr. Georges further stated that these arrangements will improve local laboratory capacity by bringing additional support to the available PCR testing capability as the territory deals with the ongoing challenge of the COVID-19 outbreak. Now, according to Dr. Georges, rapid antigen testing capability will form a part of the national testing strategy. He said the ministry will therefore work with all local laboratories to ensure standardization of reporting and testing methods. Now, the CMO further stated that the Department of Information Technology has been enlisted to develop and implement a solution to manage the national testing strategy, in addition to streamlining and eliminate the current data issues that have been plaguing the system. The rapid increase in positive COVID-19 cases in the BVI has resulted in persons having to wait beyond the usual 24 to 48 hours for the COVID-19 test results, according to a recent media release from the Health Ministry. Due to the testing lab being overwhelmed from the large volume of daily samples, results can take up to 72 hours to return persons.
Well, still ahead, Dominica's recent increase in positive COVID-19 cases has been linked to travelers originating from the BVI, and the CDC issues level 4 travel alert for BVI as COVID crisis engulfs. All this and much more after a word from our sponsors.
Is business slow, cash flow down, hosting an upcoming event? We can help. Advertise with 284 Media and take your business or event to the next level by enhancing your present marketing and messaging strategies. Allow our team of experts to create a personalized ad that sets your business apart from all the rest. This could be your business or event. So, what are you waiting for? Contact our marketing team at 284media@cctbvi.com. Advertising with us works.
Well, welcome back, viewers. With a recent increase in COVID-19 cases in Dominica, which has resulted in approximately 30 persons being placed in quarantine, has been traced back to the British Virgin Islands. Well, this is according to Dominica's Health Minister, Dr. Irving McIntyre, who made a statement during the July 18th media release. Well, according to Dr. McIntyre, 6 travelers from the BVI arrived in Dominica on July 6th, of which 5 tested positive for the COVID-19 virus at the end of their quarantine period, which was spent in the village of Grand Fawn. Listen in.
On July 6, 2021, 6 travelers arrived in Dominica from the British Virgin Islands and were quarantined at a safe-in-nature COVID-certified property. At the end of the quarantine period, 2 travelers tested positive and were admitted to the St. James Isolation Unit. The other 4 travelers who tested negative were retested on day 5, 3 of whom turned out positive and were also admitted to the St. James Isolation Unit. Given that all the positive cases were from the Grand Forks community, over the last few days, the Ministry of Health has been on the ground in Grand Forks. Swabbing and testing of primary and secondary contacts, as well as random testing of residents of the community, has been ongoing over the past 3 days. Additionally, all other persons who are identified as primary and secondary contacts who do not reside in the community have also been tested and quarantined. On Friday, July 16th, 32 primary contacts were transferred to the government quarantine facility in Portsmouth. Out of these primary contacts, only 2 returned positive results. These 2 individuals were admitted to the St. James Isolation Unit, and all primary contacts of these 2 new cases were all identified and swabbed for PCR testing, all of which came back negative this afternoon. Out of an abundance of caution, all primary contacts will remain in quarantine and be retested on day 5.
Well, Dr. McIntyre also revealed that a total of 71 PCR tests and 174 rapid antigen tests were carried out for primary and secondary contacts from July 16 to July 18th. Of those tests, only one positive result returned to take Dominica's total active positive COVID-19 cases to 25. While to avoid the possibility of more cases in the community of Grand Fort, Dominica's government decided to place the community under a stay-at-home order with bars and other public gatherings suspended following the new COVID-19 cases. Take a listen.
As a precautionary measure, we have decided to take the following measures to minimize the risk of spread of Grand Fort and the wider community. With immediate effect for the next 7 days, we are initiating the following actions for the community of Grand Fort. 1. Limited access in and out of Grand Fort to essential travel only, such as medical emergencies, delivery of goods, and maintenance of public utilities. Individuals are encouraged to remain within the community and avoid any form of public gathering. With respect to public gathering, all churches, sporting activities, and other social activities are suspended in the community. All bars should be closed and the sale of alcohol will be suspended. Grocery shops may remain open with strict adherence to health protocols and will close from 6 p.m. daily. Individuals who work outside the Grand Fort community are encouraged to remain home for the specified period. Residents are reminded to avoid visiting the elderly and homes of other relatives and friends. Community testing will continue, and residents are encouraged to volunteer and participate in the ongoing community testing.
Well, in addition to those measures, special arrangements were made for all students taking the regional CHC examinations to avoid any disruption of their exam schedule.
Now on to more COVID-related BVI news. The Centers for Disease Control and Prevention has issued a Level 4 COVID-19 travel alert for the British Virgin Islands, which is a very high alert that calls for Americans not to travel to our shores because of the ongoing COVID-19 crisis here. Now the alert includes the following warnings. Avoid travel to the British Virgin Islands. They say if you must travel to the British Virgin Islands, make sure you are fully vaccinated before travel. CDC further said that because of the current situation in the British Virgin Islands, even fully vaccinated travelers may be at risk for getting and spreading the COVID-19 virus. The most recent statistics from the BVI officials has seen some 17 COVID-19 deaths since the pandemic, 16 of which occurred in the past 2 weeks. 16, yes, of which occurred in the past 2 weeks. Now, health officials have not provided further details about the most recent COVID-19 statistics in the BVI since Saturday. Now, according to the latest report, numbers provided at the end of last week, there were a total number of 1,559 active cases and 27 hospitalizations. Now, the crisis viewers here in the BVI has led many to get vaccinated, as was mentioned yesterday, with some 800 plus new vaccinations during the recently held weekend drive that spanned Saturday and Sunday. Official numbers said that 753 people were given a first shot, while 134 individuals received their second dose of the AstraZeneca vaccine. In light of the effort's success, the vaccination drive continues throughout the territory this week and ends on Saturday, then moving on to our sister island of Virgin Gorda. Now, BVI officials do believe that the Delta variant has been the cause of what is the worst COVID-19 surge here in the territory of the Virgin Islands. Now, over in the USVI, the VI Consortium reported that late Saturday, USVI health officials said they expected 12 samples sent for final sequencing will return positive as the Delta variant. Now, the variant, the most viral strain of COVID-19 to date, is said to be between 40 to 80% more transmittable than the Alpha variant and has proven to penetrate vaccine by reinfecting some inoculated individuals, though the vaccines are still effective against the strain. According to the Wall Street Journal, citing data the publication gathered from the Johns Hopkins University, the United States has reported an average of 32,287 new coronavirus cases each day over the past week, more than double with the 7-day average was 10 days ago. Now, the uptake in cases has touched every state and Washington, D.C., with the 7-day average of newly reported cases exceeding the 14-day average in each place for the past 4 days. USVI Governor Albert Bryan at a recent press conference weighed in on the crisis here in the BVI when questioned by a reporter on assistance that could be given to the BVI. Bryan said he believes the BVI should go on lockdown as well as have all frontline workers vaccinated. Take a look.
Like I said on last week, the delegate and I have been having a lot of conversations, State Department, CDC, HHS, trying to figure out a way, White House, to give them. But the plea has to come first from them directly to the United States State Department, and then they can assist. They were having some problems locating that. What we can do is, and I have to be careful how I say it, anybody who comes to our shores could be vaccinated. Anybody who comes that we get over into the islands as sick, we have to take care of them. But we can't solicit and say we're going to send our vaccines or any equipment or anything that we have over there that was purchased with federal money. And unfortunately, all of our supplies were purchased with federal money. But we do have a dialogue with the BVI, and we are helping them with things as they come up that we purchase with our local money. You know, there were situations this weekend that I care not to mention that might have precipitated some emergency movements. Thank God it didn't come to that. So we are here for them. I mean, if it comes to a point where it's between me pissing off the federal government and saving my people in the BVI, you know, that's not a question for me. We could just have to send it. Vaccines really don't give them that much help now. I mean, you're talking about 3 weeks before they even get any kind of real antibody count in their systems in order to be able to resist the virus. Right now, what they should be doing is locking it down 24 hours, I think, making sure they have the support in their hospital, making sure their hospital staff is vaccinated, the public safety staff, and really kind of prohibiting people from moving around as much as possible to get their numbers where they need to. The good thing that I always say, numbers that come high, come fast, go fast. So, you know, we're at about a week and a couple of days now are that steep incline they went up. So those people are recovering, for, you know, hopefully the ones that didn't succumb to the virus. So it should start to go down fast. If they lock everything down, then it stays that way. And the good news for them is, you know, with a population of 30,000, you figure at least 10% of their population already had COVID by now. And that is an insulator in itself. And that 10% is probably the people who move around the most. So we've learned some lessons in doing this. That's why we're testing. Listen, if you feel sick, do not come to work. Do not go out in the public. The other thing that's hampering them is it's taking them 3 days to test people. So by the time you figure out that you have you go and you test, you're supposed to go home and stay there. If you walk around 3 days later, you have infected 10, 20, 30 people. So, you know, I just pray for them over there in the situation that they're dealing with.
Viewers, that was the governor of the U.S. Virgin Islands, Sir Albert Bryan. Now, Kamal, once again, we see where the governor of the USVI is weighing in on the situation here in the BVI, as we are very closely knitted. He did raise some valid points, though, one of which being, despite the fact, even though we are encouraging persons to be inoculated, the point of vaccination is essentially somewhat gone, in the sense that it takes at least 2 to 3 weeks for persons between vaccinations to be properly inoculated. However, in his quest to give advice, he also mentioned that he believes that frontline workers should be vaccinated, as well as a possible 24-hour lockdown. Now, unless the governor, with all due respect, is giving some financial support to the BVI economy, I don't think he necessarily has the right to suggest a lockdown, particularly when the U.S. Virgin Islands themselves have never gone on a 24-hour lockdown. But I do think he raised some valid points outside of that.
Indeed, and obviously the health minister would have touched on the possibility of a lockdown when questioned a couple of weeks ago, where he would have said that lockdown presently is not the solution.
Correct.
Basically, he would have said that lockdown usually is to keep out the virus, but obviously with the virus now in the territory, it's a situation where you now have to contain the situation adhere by the COVID-19 protocols, wear your mask, social distance, go and get tested, get vaccinated, and basically wait until the results,
On an already stretched and struggling economy.
Indeed. Well, up next, viewers, Antigua's Prime Minister blames BVI's Chief Environmental Health Officer for COVID crisis, where he later says comments were a pushback following Michael's public criticism. All this and more after a word from our sponsors.
Is about these people.
It's always a pleasure coming to you live and direct from the
What's poppin'? What's really good?
Davis has won it for the Lakers.
Welcome back, viewers. Antigua's Prime Minister Gaston Brown has blamed the BVI's Chief Environmental Health Officer Lionel Michael for the territory's spike in COVID-19 cases. Brown made a comments during his guest appearance on an online program which was published by Antigua Newsroom on Monday, July 19th. Take a listen.
Lionel Michael again. He's probably too bright. He went to one of them Ivy League schools. He told me that, sent me a text to say that he went to an Ivy League school and therefore he's an expert in public health, just as I'm an expert in finance. I said that, Manchester Business School, University of Manchester, where I got my master's degree, is an Ivy League school. I never once said that in public to anybody. Not that that bothers me or that concerns me. Yes, I do have a master's degree from Manchester. But this guy is just so full of himself that he goes out there and put all kind of information in the public domain to present himself as the god on COVID management, the ultimate authority, telling people that when they're out in public they should not have to wear a mask. But guess what, Lionel Michael, you don't determine the policies of my government. You work for the BVI, that is where you get paid. You botch the COVID management to the extent they have the highest per capita COVID active cases in the world. Go and study that and stop minding our business. Not because you're Antiguan and you have a certain level of expertise gives you the right to undermine the good work of all of our public health officials. You really pass your place. You take a dose of hush. I haven't said that I still like you as a friend, but I just sense that you're overdoing. You need to retreat.
Following the publication, 284 Media reached out to Prime Minister Brown to ask where he heard the alleged comments, which he said was made by the Chief Environmental Health Officer Michael on mask wearing. Prime Minister Brown replied, and I quote, "He made a statement on an observer radio program, to paraphrase, that mask wearing outdoors unless you are in a gathering is unnecessary because people need to breathe fresh air," end quote. Brown said he had an issue with Michael's stance on mask wearing, which he said would destabilize the enforcement measures set by his Antiguan government, which are in place to combat the COVID-19 virus. He said, and I quote, "Such a policy would undermine the enforcement of mask wearing outdoors because it could give the violator a defense for not wearing a mask if caught outdoor without one. As a public official responsible for COVID management, he was out of order to publicly undermine the Antiguan and Barbudan people's efforts in containing COVID-19, end quote. Brown also said that his comment about Michael's performance was a pushback against what he viewed to be a public attack on his government and the people of the Antigua and Barbuda's stance on COVID-19. 284 Media also reached out to the Chief Environmental Health Officer Michael, who detailed his rationale surrounding the wearing of masks while in public. Michael said he has never once advised persons not to wear masks while being in public. Take a listen.
I never recommend or advise any business, any agency, any individual, anybody not to wear masks in public space. That would be contrary to the World Health Organization guidance on masks and contrary to my own knowledge about masks. I have been involved in masks even before COVID-19, when we have occasion to recommend masks to use by people who work in auto body repair shops, who work in boatyards, who spray agricultural pesticides, who paint, and so on, who work in hazardous industries. So I know all about masks even before COVID-19. So I would never recommend to anybody to any agency, to any department, not to wear masks while in public space. What I state, and I maintain, is that there is no scientific reason, there is no scientific rationale for wearing masks in open air setting in which ventilation is in abundance and people are 6 feet apart. That's all I always state. They don't understand the concept, they don't understand the statement. So what they do, they go and twist it. Because the BVI mask mandate, which is among the best in the region, we in BVI have some of the best mask guidelines on the use and wearing of masks. And our mask mandate says, when you are outside in open air, ventilation, well-ventilated areas, right, you don't have to wear your mask. It's in the BVI protocol.
What Michael said his stance is similar to that of the World Health Organization's guidelines on mask wearing while in public, where persons should only have to put on a mask under 3 specific conditions. Take a listen.
WHO says, wear your mask under 3 conditions. 1, when you're in crowded spaces and you cannot practice 6 feet apart, you have to wear the mask. Number 2, wear your mask when you're in confined or enclosed spaces, such as when you are indoors and there's lack of ventilation. WHO says, wear your mask when you're in close contact with people, such as when you're having a conversation with them. Wear the mask. And I always live by those guidelines. I understand them. I was trained in the whole question of masks and the use of respirator and personal protective equipment. So I don't know where could I have ever stated that people not to wear masks in public. Antigua mask mandates say you must wear the mask on any street, whether people there or not.
Well, the law in Antigua and Barbuda states that it is mandatory for persons to wear masks at all times while in public, even if the persons are traveling by themselves. Ron, this is a very interesting story coming out of the region. Absolutely. Where we see 2 top professionals, one in health and obviously the other Prime Minister, having different views on the policies surrounding wearing of masks.
It's not only different views, it's more of a match, and I don't think this is a time or place for a back and forth, but we do respect both sides of the coin, and I do think that in the final analysis, we can learn from each other more than we can condemn and criticize each other. I think that's important. What works for Antigua may not necessarily work for us, but that doesn't mean that it's wrong or incorrect.
Indeed.
Viewers, before we head out, in keeping, of course, with the heightened COVID restrictions, the Administration Office within the Royal Virgin Islands Police Force will change the process for accepting police certificates, police reports, and visa waivers. Now, persons requiring a police certificate can place a completed application along with the supporting documents, in other words, 2 passport-sized photos, for 1 single application, and a copy of a passport profile page in a sealed envelope, and place that envelope in the drop box provided in the reception area of the Roadtown Police Station. Now, the name and email address of the contact as well as contact number of the applicant must be placed on the front of the envelope. Similarly, persons requiring a police report can place a completed application in a sealed envelope with the name and contact information of the applicant. Payment for these services will be on a collection of the request documents at the appointed date and time, and cash is not to be placed within the envelope of any of the applications. Now, if you have any further questions or to make an appointment between 9 a.m. and 1 p.m., you can do so by calling the Royal Virgin Islands Police Force at 468-5331. Viewers, that is all the time we have today for local news, but we want to encourage you to continue to have a good rest of the day. A happy Tuesday to each and every one of you. I'm Ron Grant. It is always a pleasure. I'll see you tomorrow.
And I'm Kamal Hayes. Have a great evening.
Bye-bye.